See important safety information at the end of the video. Only your doctor can determine if this therapy is right for you. If you struggle with painful neuropathy caused by diabetes, or if you're a doctor who treats patients with DPN, know that you are not alone. In fact, of the more than 26 million people in the US who have diabetes, 22% will eventually develop DPN pain. What may start as an uncomfortable numbness in the feet can progress into a burning or stabbing pain that spreads into the legs, becoming progressively worse and excruciating, making it nearly impossible to walk, stand, or even rest or sit comfortably. If you're dealing with moderate to severe DPN pain, you've probably already experienced or observed most of these symptoms and tried diet and exercise to control your blood sugar, plus creams or ointments or medicines to deal with the pain. But the guesswork and side effects of some of those treatments can be nearly as frustrating as the pain itself. Fortunately, a therapy commonly used to treat other types of chronic pain has been approved to treat moderate to severe DPN pain in the lower extremities. It's called spinal cord stimulation, or SCS, and it offers hope to those who may have been left feeling hopeless. It works like a pacemaker for pain. A small device called a neurostimulator is implanted just below the skin, and it sends mild electrical impulses to the spine over thin wires called leads. The impulses interrupt your pain signals before they can reach the brain, essentially outsmarting pain by reaching your brain before the pain signals do. SCS can feel like a gentle or pleasant massaging vibration over painful feet and legs. And, just like a massage, you can control how strong it is, from intense to so light you may not feel it at all. You can also decide when to turn it on and off, and teach it to automatically manage therapy based on your position. 70% of patients implanted with an SCS system to treat DPN pain experience meaningful relief of their symptoms. And patients experiencing DPN pain are 17 times more likely to experience significant pain relief if treated with SCS than if they continue to receive their normal treatments. Not everyone will respond the same way to spinal cord stimulation, but for some, and possibly you, it could be the answer to feeling a bit more like yourself again. Important safety information. Indications. Spinal cord stimulation, SCS, is indicated as an aid in the management of chronic, intractable pain of the trunk and/or limbs, including unilateral or bilateral pain. Contraindications. Diathermy. Energy from diathermy can be transferred through the implanted system and cause tissue damage resulting in severe injury or death. Warnings. Sources of electromagnetic interference, defibrillation, electrocautery, MRI, RF ablation, and therapeutic ultrasound can interact with the system, resulting in unexpected changes in stimulation, serious patient injury or death. An implanted cardiac device, pacemaker, defibrillator, may damage a neurostimulator, and electrical pulses from the neurostimulator may cause inappropriate response of the cardiac device. Diabetic patients may have more frequent and severe complications with surgery. A preoperative assessment is advised for some diabetic patients to confirm they are appropriate candidates for surgery. Precautions. Safety and effectiveness has not been established for pediatric use, pregnancy, unborn fetus, or delivery. Avoid activities that put stress on the implanted neurostimulation system components. Recharging a rechargeable neurostimulator may result in skin irritation or redness near the implant site. Adverse events. These may include undesirable change in stimulation, uncomfortable, jolting, or shocking, hematoma, epidural hemorrhage, paralysis, seroma, infection, erosion, device malfunction or migration, pain at implant site, loss of pain relief, and other surgical risks. Adverse events may result in fluctuations in blood glucose in diabetic patients. Refer to www.medtronic.com for product manuals for complete indications, contraindications, warnings, precautions, and potential adverse events.